All right, hello there. This is Christian Nix, and welcome, everybody. I want to talk to you in this video about autoimmune conditions. This is a very touchy subject, I would say, for a medical professional to address, especially if you're outside of the mainstream of medicine, which I firmly am. But I actually have a fair amount of experience in this. Now, I'm not trying to take the place of your doctor. I'm not an emergency kind of doctor. I'm a guy who figured out how to help people with serious digestive conditions. And for sure, for a lot of people, for a lot of you watching this, this is going to be autoimmune kind of condition. Autoimmunity will be part of your very unpleasant and unfortunate journey. The good news is you can do something about your autoimmune condition. A lot of people will actually exhibit autoimmune symptoms and don't know it. And so that's a big part of this video here. I had a very interesting episode that happened to me. I was speaking to a doctor recently, a conventional medical doctor, and he said something that really triggered for me, the realization that mainstream medicine sees autoimmunity. First of all, they see it very poorly. They don't have a good way of understanding autoimmune conditions, and I'm going to prove that to you here. Those of you who are suffering with autoimmune symptoms and have been to a doctor and are taking whatever medications they give you for them already know that. But for those of you who may not even recognize that you're dealing with, quite possibly, either low level or even, in some cases, full-blown autoimmune symptoms, it's a nightmare. It's a nightmare that's made even worse by the fact that very often, right, your doctor actually has no clue how to either help you identify what's happening or, as is even more frequently the case, how to get yourself out of that. And like, say, with acid reflux, you're going to end up getting medications that actually push the condition, you could say, deeper inside you, like make the situation worse, right? That complicate your healing even more, because the medications themselves are based on a lot of very poor short-term thinking. Okay? So first of all, how do you recognize an autoimmune reaction or autoimmune kind of symptom complex? When you have an autoimmune reaction, when you have an autoimmune condition writ large, you don't just have one symptom. So broadly speaking, whatever your symptoms are, whether that's just garden variety acid reflux, or at least in your own mind, garden variety acid reflux, there's really no such thing, right? Or whether you have, even stretching, on down your digestive tract to full-blown IBS, right, kind of symptoms. Acid reflux, everybody knows, but diarrhea, constipation, multiple trips, 25 trips to the toilet during a day, explosive elimination, right? Cramping, pain, stabbing pains in the abdomen, all of the various things that make up IBS, right? Whichever end you're suffering from, digestively speaking, how do you recognize symptoms of autoimmunity? And what does an autoimmune condition actually look like? And how do you know? First of all, typically, if you're dealing with an autoimmune situation, and I explained elsewhere the mechanism that gives rise to autoimmunity, I'm not going to do that here. But if you have an autoimmune situation, if you have an autoimmune flare-up reaction, you're looking at an acute episode of very severe symptoms, usually increasing in severity as your condition worsens. In other words, whatever your symptoms might be, whether that's just acid reflux that you're paying attention to, or whether it's cramping, stabbing pain, right, all of the various things that can happen deep inside your digestive tract, especially in your lower bowel, your lower intestines, you could have very, very, very severe flare-up of symptoms. Now, it won't stay just as digestive symptoms. For most people, there's going to be also an elevation. You're almost certainly going to have worse sleep. If this goes on for a long period of time, right, you end up with really, really pronounced weight loss. Okay, and weight loss is also a symptom of several other very serious conditions, like cancers, like diabetes. So you never take lightly when you're losing weight for reasons that you can't figure out. But if you get screened for cancer, if you get screened for diabetes, and your doctor says, well, that's not it, then you may be staring at an autoimmune condition right in the face. It could also be, again, a severe acute episode, a severe flare-up of diarrhea, for people with serious IBS, cramping, stabbing pains, what's called binding pain in the lower abdomen. That's a type of, obviously, cramping. Even what's called mounting pain in the Asian medical model. It's like a pressure downward. Men tend to get this, I think, more than women. You can get pain in your testicles, right? And everything in between, okay? And a lot of different things. Remember also, once it moves out of your digestive tract, remember, I mean, autoimmunity is a systemic condition, so it's not going to stay just localized in your digestive area, in your abdomen. If you have an autoimmune flare-up, you could be looking at serious joint pain, right? Rheumatoid arthritis is almost always tied to, at least some portion of it is tied to autoimmunity. For I was going to say women, because it is normally women, but for people with fibromyalgia, which is usually women, you could have a severe flare-up of whole body pain. That's an autoimmune reaction very often. On to what's called scleroderma, lupus, erythematosus, various things happening as your body attacks your own organs. Autoimmune disease is when your body's attacking its own tissues. Why would your body do this? Well, I said I wouldn't explain, and I won't go into the full mechanism, but if you damage the inside of your intestinal lining, and most people with serious digestive disorders will get to this point. You may not be there, you may partially be there, or you may have been there for many years, and you're dealing with the consequences of what I'm describing now, which is the lining of your intestines, once it's damaged, right? You have little villi, they're called. It's like a layer of cells with tiny, under a microscope, it looks like little hairs. And the hairs trap the bacteria and the large food particles, which are then broken down into smaller food particles, and only the tiniest part of the food particles, the nutrients that you can absorb, get to the intestinal lining and then pass through the intestinal lining into your bloodstream to be used as fuel for your body, okay? When you damage the villi and this whole layer of cells is gone, right, you have inflammatory, irritable bowel with what is called then leaky gut syndrome. Meaning that food particles and lots of foreign bacteria, lots of harmful bacteria that's supposed to stay in your gut is now leaking through your very porous, very thin intestinal membrane into your bloodstream. And now your body thinks that you have a systemic infection because in fact you do. Bacteria is leaking into your bloodstream from your digestive tract and there's nothing to stop it. And this goes on and on and on. And certain things will trigger this response more than others. And when you trigger this response, your body freaks out, right? It's like somebody hit the panic button and it's red alert time as far as your immune system is concerned. And if you trigger this thing over and over again, your body will begin to attack various other parts, including your joints, your synovial capsule fluid, right, that's in your joints to protect your joints, your knees, your ankles, possibly hands as well, but usually the big joints first, hands and feet last. And that's in addition to all kinds of other things. You can even develop, autoimmune heart kind of palpitations, arrhythmias, right? Disruption in the normal rhythm of your heart. Things of this nature. Rheumatic heart disease, right? So this autoimmune thing, first of all, to recognize it is to understand that you're having an episode of a flare-up of maybe your normal symptoms, but maybe even something beyond what you normally experience as symptoms of digestive distress. A very serious flare-up. Like no bullshit, you can't even lie to yourself that something terrible has just happened inside you. You can't put a spin on it and be like, no, I'm going to be okay. It's like, whoa, I don't know if I'm going to be okay here, okay? That's an autoimmune flare-up. Now, if you're experiencing this, on any kind of regular basis, and again, I'm not taking the place of your doctor here. Okay, if you're in serious trouble, you get to an emergency room, always. But you also need to understand what modern medicine has to offer for that and why you're better off trying to figure out how you can fix this on your own. Okay, first of all, as the old saying goes, right, if you're in a hole and you look around and you're deep in a hole, stop digging. It's very important to figure out what causes your autoimmune reaction and stop doing it, right? Stress by itself will make you prone to this. I go into the stress response and the stress mechanism in all of my training programs, okay? So if you're studying anything from me, you're going to get a good, long, detailed explanation of what that is and what it does and how it works and how not to keep triggering your stress response when you're trying to digest. Okay, it's very important to understand this. But you need to identify the offending substance. You need to work to alleviate any kind of exposure to that, and then you need to take the specific steps that help rebuild your pivot mechanism, the balance, in essence, between your rest and digest mode and your fight or flight mode inside your body and your digestive and immune systems. Okay, your liver and spleen, as we categorize this inside the protocol. Okay, because if you can't figure that out, if you don't go that direction and figure out how to solve your autoimmune condition yourself, what you're going to get is the worst kind of short-term thinking from modern conventional medicine. And this is very, very important to understand. Just as your doctor gives you an acid-blocking medication, knowing full well that there's no possibility of normalizing your digestive system when you're blocking your stomach acid, so too your doctor may, for an autoimmune response, prescribe what is essentially the standard treatment, which would be steroids, usually prednisone, something of this nature, a steroidal, usually oral, possibly injection, to try to calm and undo and damp down your body's inflammatory response to the offending substance. Now, any amount of reflection on that particular, just philosophically, the idea that you should calm down the body, you know with about 30 seconds of thought that that's a very short-term solution. Now, if you can't breathe, right, or you're going into shock or something, there is a place for short-term solutions. There's no question. But I'm talking about the situation where doctors, prescribe you with 2 or 3 weeks or a consistent regimen of prednisone or whatever other steroidal solution that they're going to offer you to try to help you manage your autoimmune condition. Okay? There's no managing an autoimmune condition with a steroid long term. They're very, very hard on your body, and eventually your kidneys will fail if you keep taking steroids. They have all kinds of other side effects, which are also known as negative effects, and you don't want to be taking a short-term relief like a steroid except for a true emergency. And that means that really your choices for what it is that you're going to do to help deal with your autoimmune condition really do begin to look and get very narrow. Now, fortunately, you can dig your way out of this hole. You can stop the problem at the source and then figure out how to get your organs to start to work together. Think of what an autoimmune reaction is. It's your body attacking your body. Your immune system is attacking its own tissues. That's the definition of your body fighting against itself. In the protocol that I teach, what you discover is there is a way to sort of get the gears of, mechanical metaphor, of your digestive and immune systems working together so that they mesh and that your body works in harmony again, that you can get all of your main digestive organs, what I refer to as the pivot, to work together again, and by that harmonization, it's a technical concept in the method that I'm teaching. When you harmonize the organs, you get them to work together again, and when they work together again, you find that you can bring yourself out of this. okay, without other medications, without a lot of trips to the doctor. Yes, it's tough. Yes, it's dangerous. But it's the best option that you have if you're not going to be stuck on, right, what is a very short-term medication for the long term, right? And typically, too, these things, it's not like time isn't a factor here. If you have an autoimmune condition and you're barely hanging on, right, in 2020, right, what do you think 2021, 2022 actually looks like? Right? What does it look like a year or 2 or 3 or 5 years down the road? Because it's not a pretty picture. When your body's that sick and you're using serious, hardcore medications like steroids to try to moderate your own immune reaction, obviously you're opening yourself up to all kinds of harm and damage down the road. Okay, so if you're thinking that it would be wise to avoid that, you're absolutely right. And the best way to avoid it is to understand what's causing it and then undo the damage by harmonizing your organs so that you spiral back up out of illness. I talk about recovery as just like when you're sick, you're spiraling down, but when you recover, you kind of spiral up out of illness and recover as your organs begin to work together in harmony again. Okay? So there's a good deal more about autoimmune conditions in all of my training material. I hope, if you're not a student, I hope you check it out. But it's very important to recognize how you can, or to learn to recognize the signs and symptoms of autoimmunity, and to not be fooled by what modern medicine, I say always, right, if you're in an emergency and you're in a crisis, get to a doctor, get to an emergency room. That's what they're there for. It's a great medical system for serious, hardcore emergencies. If you got to stay alive and you're at death's door, get to the emergency room. That's what they're there for, okay? But if you're dealing with a chronic digestive illness, right, anything chronic in nature, and most chronic conditions will, by the very nature of chronic disease, right, end up affecting your digestive system and or your sleep system, then you need to be looking at something that treats chronic conditions. And that's what this protocol does. That's what all of my training is designed to do. That is my area of expertise. So not only did I practice for about a decade, I still see patients from time to time. Not only did I practice for a number of years helping people in clinic, which means that I have clinical experience to know what I'm talking about. This is not a bunch of nonsense that I read in a book. I also went through an autoimmune condition that was very, very serious for a number of years. I went through everything I'm describing to you in this protocol, right? From flare-ups to weight loss, right? I didn't think I was going to recover ever, right? But I did, and I found out a way to do it very quickly, found out to get off the modern medical merry-go-round and to take matters into my own hands. And there is a way to safely do this. Everything I teach is very, very safe. There's a way for you to recognize what's happening and then get busy repairing your important digestive organs. So I hope you'll check it out. Thanks very much. I'll be back in another video.